our last area that we want to inject is the nasolabial area in order to make this a little bit less sharp. By injecting the midface with Juvederm Voluma, we have already created a smoother transition from the perioral area into the cheek, but in her case, and that was also one of her specific concerns, we still see a superficial line, especially the lower part of the nasolabial fold, that concerned her, and that gives her a little bit of a sharp look that she wants to get rid of. So for injecting superficial lines, giving support and long duration, and at the same time perfect tissue integration, my product of choice is Juvederm Voleft. So the last injection that we are going to perform on her on this side is injecting Juvederm Voleft in the nasolabial fold. So for the last area to be injected, the nasolabial area, I asked the patient to sit upright again, because the nasolabial area is an area which is clearly subjected to the forces of gravity, as the mid-face portion of the tissue is shifted depending on our positioning. So if we lay the patient down too much, we may not see the severity of the nasolabial fold to its full extension. I mentioned before, within the collection of Juvederm VYCROSS, Juvederm Voleft is the perfect product to inject more superficial lines like her superficial nasolabial fold. It has substantial amount of hyaluronic acid to provide good support without overfilling superficial lines, and due to its VYCROSS technology cross-linking, it does not contain or bind additional water. So we have created already a smooth transition from the upper part of the nasolabial fold into the cheek. Still, I would like to give that little triangle next to her nose a little bit milder appearance. So my first injection point of Juvederm Voleft would be in the upper part of the nasolabial fold. Don't be afraid. I aspirate here, and I'm slowly injecting in bolus technique 0.2 cc of Juvederm Voleft. That also has an additional lifting effect on the upper lip by providing deep tissue support in that area. In order to avoid too sausage-like look in the nasolabial fold, I tend to not inject in retrograde tunneling technique, but I rather prefer to stretch out the nasolabial fold a little bit with my fingers and inject little boluses in the deep dermal tissue area with an oblique injection. We are here a little bit more superficial than in the direct perinasal triangle, and this is why aspiration is not as crucial as next to the nose, because we may encounter here the angularis artery. Stretching out here, injecting in an oblique manner, creating little cutaneous pillars which fill the gap and smooth the transition without creating a linear aspect of filler in that area. Are you okay?
Yeah.
Another interesting side effect of this technique is that you hardly ever create bruises, because you, by stretching the tissue, you somehow lateralize little vessels by pressing with your fingers, and by just letting the product glide into the space that you create with your fingers, you close this little gap in the tissue that creates the fold in a very natural way, without creating little lines which may result in an unnatural treated look. So in total I have used 0.5 cc of Juvederm Volulift for correcting her nasolabial fold on that side.